So if we look at our toothpaste, the function of toothpaste, what does toothpaste do? What makes a toothpaste high performing? What allows a toothpaste to be optimal for your oral care? And the primary function of toothpaste really is to remove the plaque, since plaque is what causes cavities. So it really needed to be based on an anti-plaque formulation. So Davids toothpaste is based around an anti-plaque formulation. We knew that we didn't want the fluoride in the toothpaste, and so for the toothpaste to be really effective, it needed to be based on an anti-plaque formulation. Touching briefly on fluoride, that is probably our number one question that people ask us. They say, how can your toothpaste work well without fluoride? Can toothpaste be high performance, work well, maintain a high oral care without the use of fluoride? So to answer that question, the ADA, the American Dental Association, by their own numbers, they say that fluoride helps prevent about 30% of cavities. So not 90%, not 70%, closer to 30%. So the benefit of fluoride has been a little bit exaggerated. There is some benefit though. There's still that 30% benefit of the fluoride. So what the fluoride is actually doing, it's a pretty strong chemical that's designed to harden the enamel on your teeth. So every time we brush our teeth, we have this food debris, we have, it's like, they call it a biofilm. It's a combination of the saliva and the food that's left on our teeth, and that can harden, and that turns into plaque, and eventually can harden into tartar. So really the most important function of the toothpaste is to remove that biofilm and to remove it before it turns into plaque, and if there is plaque formation, to remove the plaque, because again, it's the bacteria in the plaque that's trying to eat through the enamel, and that's what causes the cavity. With fluoride, the fluoride is working to artificially harden your enamel. So as you get the plaque on your teeth and you're hardening the enamel, it makes it harder for that bacteria in the plaque to eat through the enamel. So that is the benefit of the fluoride. The downside of fluoride though is that every time you brush your teeth with fluoride toothpaste, that fluoride gets absorbed through your gums. It goes into your bloodstream. So that is the concern of fluoride, is that you're getting some benefit up here, it's hardening your enamel, but the big concern is what is it doing as it goes into your bloodstream and goes into your body. And the reality is we don't have little video cameras inside our body that show exactly what it's doing, but we do know it's a very strong chemical. Every fluoride toothpaste is required by law to have a warning label on the tube of toothpaste. If you've ever looked on your tube, it says there's a warning label that says if more than brushing amount swallowed, contact poison control. So that was one of the things that was first kind of alarming on my own tube of toothpaste, like why is there a poison control warning on my toothpaste? So Davids, the way our toothpaste works is instead of hardening your enamel, we have a number of ingredients that work together to kill off the bad bacteria in your mouth that forms the plaque. So instead of working as a defensive mechanism to harden the enamel, our toothpaste is more on the offense. We're working to kill off the bad bacteria before it even turns into plaque. And then if there is any plaque formation, we use very high grade microabrasives that are designed to remove the plaque.